The Public Servants Association in KwaZulu-Natal have seized mobile clinic service operations in Umlazi, Umbumbulu, KwaMakhutha and surrounding areas for over a week now. This follows a recent hijacking incident and escalating crime rates, leaving residents without critical emergency medical support. Here's SABC News Reporter Nonhlakanipho Magwaza standing by with more with the PSA for more on the story. So Nonhlakanipho, who do you have from the PSA and how critical is the situation where you are?
Good morning, Mxo, and to the viewers at home. Apparently the situation is very bad as mobile clinics have been suspended in this area, Umlazi, Efolweni, Umbumbulu, because of the recent hijackings. You'll remember, Mxo, that previously it was the ambulances that have been subjected to hijacking, and the department says that with the ambulances, they are now being escorted into township areas by police. But with me now is Public Servants Association spokesperson, Mr. Umlazi, who will be telling us more about these incidences, because this recent one is not just the only one. Apparently it happened at Mega Pilani here at Umlazi. Mr. Ndlovu, you said that this is not the first incident. It's one of many incidences that happen here in the province, not just Umlazi. Just tell us more exactly how rife is the situation, or how bad is the situation?
As PSA, we are concerned in KwaZulu-Natal. As we have said, this is not one of the first incidents where around Mega Pilani, one of the clinic staff was hijacked and kidnapped and taken to 17 and taken to the graveyard where he was forced to withdraw the money. You've got cases at Umkhanyakude, some of the ambulances where they have been hijacked. It's become a concern because if they've suspended this mobile clinic, which means the communities won't be able to get the services. We are saying as a PSA in the province, we need to work as collective. We have engaged with the HOD. HOD is not assisting because it's not responding, but the MEC has promised to be able to engage with us, and that's a positive sign because we believe that the community leaders, the police must be able to engage, because you'll not have a situation where staff who service the communities are being hijacked. The majority of them are afraid. Who's going to suffer? It's going to be the citizen. So we are saying it's a serious matter, whether it's ambulance, whether it's social workers. We've got this crisis in the province where we appeal to the provincial commissioner to say, let's be able to work together. We appeal to the municipalities to be able to close rent, because some of our members want to resign from these particular hospitals because we are facing with these challenges.
Mr. Ndlovu, you said that the mobile clinics have been suspended up from the 13th. Who suspended it? Is it the workers who said that they are not going to work, or is it the public, the unions who said that they should just down tools? Who exactly suspended these mobile services?
So the good thing is that the management have taken a decision to suspend the mobile clinic because it was not safe for our employees. But the question is, it's for how long? Because we must work on the long-term solutions. Because as we have indicated that as PSA, our members are losing their belongings, cell phones, some of them are losing their car keys, some of them have spent over 7,000. This is not being paid back by the department. We are saying there should be insurance. They should be also look in terms of the branding of the state vehicle, because some of the state vehicles is easy to be identified by the criminal. So we're expecting a response. That's why we have requested to meet with the HOD, who's not willing to meet with the PSA, is not responding to us. But the positive is that the MEC is willing to engage with us because we want to be part of the solutions. We don't want to be part of the problems. Otherwise, majority of our members are afraid to go and service these communities. What's going to happen to the citizen? That's why it's a responsibility of all of us as communities to protect these public servants, because the service that they are providing is critical. The majority of them, they don't have medical aid. So some of them were expected to get their medications in the past 2 weeks. Now they need to visit the hospital, which means you're now increasing the workload in the hospital. This hospital is overcrowded. They've got their own issues. You know, you go to ICU, they've got problems where ill treatment and victimization of staff, shortage of staff. Those are the challenges we're saying we must be able to engage and able to find solutions.
We did speak to the department earlier. Obviously we didn't know about the mobile clinics. We thought it was the ambulances, and they said that the ambulances are being escorted escorted if there's a call out for them. Is this true? Have you seen the ambulances being escorted into these areas?
It's not all the ambulances, as I was giving example at Umkhanyakude and some part of the provinces where they are still being victimized because the subs complain about the issues of the manpower, and we understand not all the ambulances will be escorted. So that's why we are saying as PSA there is a serious concern, because around here also Umlazi, in certain clinics, criminals are doing as they please, so employees are afraid of their securities. We must take care of the ambulances in our provinces because they provide critical services. The department provides this mobile clinic to service our communities. So we are doing our research to ensure that we get as much information, because we must be able to work together. And we are saying to the MEC, we must activate Safety and Security Committee, because Section 8 of the Occupational Health and Safety Act is very clear on the responsibility of the employer to ensure that our employees are safety. Otherwise, we're going to face with challenges where people are going to resign in these provinces and go to the other provinces. So we will not compromise our members as PSA. We are calling all the members that are affected to report to us. We are saying the department should compensate those people that have lost their cell phone. They should be able to ensure that there is proper insurance. They should be able to get danger allowance because they are working in dangerous areas.
Mr. Ndlovu, just one last question. You said that the mobile clinics have been suspended. They are not going to Umlazi. Is it just Umlazi, the eThekwini area, or the whole of KZN?
So currently, this mobile clinic, they are servicing Umlazi, Folweni, Makhutha. As we speak, they have been parked here. So we're waiting for the solutions so that we can be able to work together. That's why we are saying as PSA, communities, leaders must be able to understand, we must be able to work together. It is our responsibility as a union of choice to ensure that we represent our members. And we're also concerned in terms of the wellness program that is provided to them, because they are being subjected to the local psychologists. At times they are giving 2 days off, others 3 days. It has a long-term effect, the psychology part of our employees. They are not comfortable. They are going to make mistakes. When they make mistake, the nursing council is going to charge them and suspend their licenses. That's why we are saying health workers are critical to our society. We must do everything to protect them, and these criminals must understand the critical duty that they are doing to our communities. So that's why as PSA we are saying we must engage all the department, and the Prim of KwaZulu-Natal must be able to engage, because the province has been compromised. Criminals are doing as they please. We must protect our citizens so that we provide services, whether it's health, whether it's education, to our communities, because they deserve better.
Thank you so much.
Thank you.
That was Umlungisi Ndlovu for the PSA, telling us about how bad the situation is in this area. He said that there was the recent incident happened at Pilani, where the driver or the staff were hijacked and were robbed of their belongings at gunpoint, and they were forced to withdraw their money. They were taken to a graveyard and forced to withdraw their money. This is not the first incident that happened. It looks like criminals here in the province are targeting state vehicles. As you'd remember, a couple of years back, they went into a Department of Agriculture or Social Services, and they took all their vans or bakkies that were parked there. And recently, it's been ambulances, it's been state vehicles. Social workers are being hijacked here in the province. We will be speaking to the department. We have posed the question to the department on how long the mobile clinics will be suspended. As you know, that in some areas, as Umlazi is the biggest township here in KZN, there are very few clinics in the area, and the mobile clinics supplement these clinics and the hospital, this one hospital that services most of the Durban South area, especially Umlazi, Umbumbulu, Folweni, and to name just a few. But we will be speaking to the department just to hear from them what is the solution going forward. Are they going to ask the SAPS to also escort mobile clinics, as they said that they are doing with ambulances? Back to you in studio, Mxo.
And Nonhlakanipho, before I let you go, just a quick one. Let's find out, because, it's quite a sad state of affairs to see that hardest hit will be those community members who will not be able to access such critical services because of these criminal elements that are now within the community. What is the community saying? What are you hearing there from the various communities?
For today, we haven't spoken about with the community about the mobile clinic, but previously the community have come out and voiced out their concerns regarding the ambulances, because what we know is that the ambulances, the staff that man the ambulances, are afraid to go into these township or any township to that matter here in the province, because they are scared for their lives. They've been countless incidences where they've been held at gunpoint, where their ambulances have been hijacked. We did speak to Umlungisi. He did mention that at Umkhanyakude they hijacked an ambulance. It was a Fortuner type of an ambulance, and it was hijacked at Umkhanyakude. Obviously, we know in that area what they do with such cars. Probably it went across the border. We don't know. But with the community, they are scared. We will be going around and speaking to the community after this, just to get their point of view of how they feel about the mobile clinics being suspended, because obviously it would have been easier for them to access healthcare services with the mobile clinic. Obviously, those who need medication, chronic medication, they can just go to a mobile clinic instead of coming to the hospital and sitting at the benches for long hours waiting for their turn to be serviced. But we will be speaking to the community as well, and we're just waiting on the Department of Health just to hear from them how long the services will be suspended.